Welcome to Penrose Learning, where we make understanding easy.
You start immediately by softening the adhesive. Take a warm shower or apply a warm compress for 30–60 seconds so the adhesive loosens. Once done, support the skin with one hand to avoid stretching it. With the other, lift a small anchor at a corner and begin peeling back parallel to the skin, not straight up, to reduce trauma. Make sure to peel slowly and stop if you feel sharp pulling. Apply oil or remover to any stubborn edge before continuing. You continue by keeping the skin taut and peeling the tape back along the skin at a low angle. This reduces shear. Once the tape is partially removed, apply adhesive remover or mineral oil to the exposed sticky area and let it sit for 20–30 seconds so the glue dissolves. Make sure to blot excess remover with a towel instead of rubbing. If the tape tears, lift the nearest intact section, reapply oil, and resume. This method prevents blistering and minimizes pain. You finish by washing the area with gentle soap and warm water to remove oil and small residue. Then pat dry and apply a moisturizer to restore the skin barrier. Once done, inspect for irritation, redness, or blisters. If you see significant reaction, stop and consult a clinician. If tape rips or sticky residue persists, apply an alcohol swab or a medical-grade adhesive remover and wait a few seconds before wiping away. Troubleshooting tip: if skin becomes raw, avoid further pulling and cover with a sterile dressing.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.